Okay, so this is a picture of me almost 4 years ago, just over 4 years ago. And it marked my return home to Watford, some 260 odd miles away from Newcastle, after I'd spent 13 months as an inpatient at the Freeman Hospital. And over the next 10 to 15 minutes, I want to give you the reasons as to why I chose to come so far away from home and so far away from all of my family, and what happened there and how it's changed my life. So my story starts in 1965. I was born at home, and here my parents, they were a bit younger then. So my mum, who was a nurse and a midwife, I was the third child she had had. And I was born, as I said, I was born at home. And after I was about 10 days old, my mum really thought that I wasn't thriving very well, I wasn't feeding, and she wasn't very happy. So she took me back to the local clinic where, after consultations with various people and the GP, it was decided I had a heart murmur. And after spending, I think, most of my first year of life in the local general hospital, I was eventually referred to Harefield Hospital, which even then was really out in the sticks from where we lived in southwest London. And while I had many happy memories of my early childhood, my time, my visits to Harefield, it was some time before I was eventually diagnosed as having tricuspid atresia. But it was a fortuitous referral, because then my paths crossed with Professor Samagdi Yaqub, or Mr. Yaqub as he was then, and Dr. Rosemary Radley-Smith, the paediatric consultant at Harefield. And when I was 9 years old, I underwent this operation, which is, I believe, is a valve conduit from the pulmonary artery to the right atrium, and I had valves put into my inferior vena cava and superior vena cava. Quite how that fits in with the nomenclature of Fontan operations, I'm not really sure, but that's what I had, and I was apparently the first patient in this series of operations. So I went home and I resumed what was, well, essentially a fairly normal childhood. And I actually would like to pay tribute to my parents in how they, I guess, only followed their instinct. There were no groups, there were no chat rooms to work out how to do what they did, but they didn't wrap me up in cotton wool. And I was also lucky that all of my brothers and sisters were all very close in age. My mum had 4 children in 5 years. In fact, after my younger brother was born, my dad says that he worked out what was causing it and put a stop to it. But the point being is we all mucked along together, and obviously my parents kept a careful eye on what I was doing, and I didn't do certain things, but it never really troubled me, and I think it led to my inherently positive outlook and taking pride in what I could do and not worrying about what I couldn't do. I mean, for example, we were a very active family. All of my siblings and my dad in the 80s and 90s all ran the London Marathon. I had no designs on doing that, but it didn't bother me. So I claim to have led, and I quite think most people would agree, a fairly normal and active life. I went to school, I went to university, and after university I've enjoyed full-time employment ever since. Obviously there were some physical limitations of what I could do. I never did any swimming lessons at school. I was let off cross-country, but that was a good thing because it was always on cold, frosty days when the pitches were frozen. Nobody wanted to run around the field in the freezing cold. I didn't have to do it. I didn't mind that. And I never really took part in any school sports days. But I did enjoy activities and I did enjoy sport. You know, my dad played cricket, my brothers played cricket, I played cricket, but just within the level that I could achieve. I remember a game where I was quite good at hockey. I had good eye-hand coordination, and they put me in the hockey team, and I think I lasted about 10 minutes on the pitch. But, I had a go. But cricket was a a sport I enjoyed. And here you can see me actually as the captain of the team. And actually my two brothers are both in this photograph. But actually, if you want to recommend to your patients an activity that suits somebody with a fontan circulation, I think cricket ticks a lot of boxes. It's a stop-start game. It's not that energetic, it's enjoyable, and also very sociable. And in fact, perhaps the social side and the fact I played a lot one weekend actually led directly to my first adverse event. When after one game, one weekend, when I was about 22, I think, I finished playing and I felt my heart's going a bit quick. I didn't feel very well, and I thought it'll stop for a bit, it'll stop. But it didn't really slow down. So on the way home, I decided to say to my parents that I didn't really feel very well, my heart was going very quick, and we went to the local A&E. And that was in fact fortuitous. Well, it was a bit of an experience because at the time they didn't know what to do with me. And I was admitted onto the coronary care unit where I was sat there with a load of old men, as they seemed to me at the time. And the doctors ummed and ahed about, could my heart really beat in sinus rhythm? What should they do? And eventually they cardioverted me, they kept me in another week in hospital, and I went home. But it had a very lucky coincidence of what happened, because it brought me back to the attention of Harefield, and Professor Yakub asked to then see me and asked me in the course of going to see him what I was doing, for work. And at the time I was working for Glaxo doing research. I'd done a degree in pharmacology and was doing essentially drug discovery. And he then convinced me to go and work for him in a laboratory that he set up with a Swedish group. And you can see me on the right-hand side with one of the Swedish doctors who helped set up the lab to look at vascular activity of human coronary arteries. Something I loved doing. I was going to watch heart transplants, to collecting the donor hearts that came out, and it was sort of the best thing that could have ever happened to me. But then something else also happened. One day, in attending heart transplants, I met this young lady who was there as a cardiac technician. One thing led to another, and within a couple of years, she became Ruth Chester. Now, it wasn't that I'd married someone who I found attractive and got on well with. It's the fact that Ruth had a training as a cardiac technician and understood the importance of A, not sitting on a problem, and B, the importance of being in sinus rhythm. So, as it happened, shortly after we were married, I got another episode of tachycardias. And because Ruth knew all of the consultants in the hospital, it was quite easy for her to attract attention to me, and I got my problem sorted out really quickly without having to repeat the episode of going to the local A&E department, meeting doctors who didn't understand what was going on, and wasting more time not in sinus rhythm. And as it happened, that my arrhythmias would sort of repeat on a sort of yearly basis. And as a consequence, through Ruth's actions and connections, and eventually people got to know me very well, that I got all my arrhythmias sorted out very quickly without any disruption, initially with drugs, sometimes cardioversions, but whatever happened, they were always sorted out quickly. I never spent a prolonged period of time with atrial tachycardias. As we were married, we had 2 children, and really as I got older and I began to understand more about fontans, and I would come across papers about fontans, and I'd read them and understand bits of them, and I was always perturbed that when I looked at survival curves, there was no one who was the same number of years post-operation as I was. So the other thing that we argued, well not argued about, but were undecided about what to tell the children about my condition. And eventually their inquisitiveness and their wanting to know was apparent. So we made a conscious effort to tell them about me from a relatively young age in ways that they would understand. And I think this was a good thing to do, because when it came to later on in life, they were able to cope remarkably well with what happened to me. And I must admit, as time went on, I got older, although I was still leading an active life and had a good quality of life, I did begin to feel a bit like a time bomb. But I always maintained and kept a positive outlook, and I sort of had this mantra of make hay while the sun shines. If it stops shining, I'll deal with it when that happens. And I didn't really worry about the future. So if I was to map in a very simplistic way how my life changed over the various decades, as I approached the sort of my 30s and 40s, there were things that I could previously do that I either couldn't do or I just had stopped doing or got out of the habit of doing. And eventually, by the time I reached my 40s, there were things that I had taken for granted that I could do that became a struggle. And really this mapped my decline or the failure of my Fontan circulation. And just to really run through it on a more sort of medical basis. So in the year 2000, it was suggested I have an ablation procedure to resolve the problems I have with my tachycardias. This was in fact unsuccessful, and after the procedure I was still in AF. But I think from having someone poke wires across my valves and muck about with the inside of my heart, and also the fact that my arrhythmias were sensitive to flecainide, I then went 10 years without any arrhythmias at all. So while it wasn't a successful ablation procedure in that I was still in the bad rhythm when they'd finished, it seemed to have some beneficial effect on me. But then, with the turn into the first decade of this century, the arrhythmias returned. And they returned in probably a more aggressive manner. So by this time, I'd been referred from the doctors at Harefield, who had seen me on a regular basis, to the Gooch team at the Royal Brompton under Rafa Alonso. And they came to the conclusion that my valves were essentially caked up and non-compliant. So they stented the IVC valve and the valve in the pulmonary conduit. And this sort of gave me a boost. And I thought I felt better, and I hoped this was going to relieve the problems I had with the arrhythmias. But as it happened, that they actually came back fairly quickly after the stenting, and I then had an ablation procedure the same year. That lasted for about a year, and then I had another 2 ablation procedures back to back in an attempt to quell these arrhythmias, which had become very aggressive. And there was one occasion when it happened at home, and in fact we had to call an ambulance. They thought I was having a heart attack because there were changes on the ECG, and Ruth persuaded them to take me to Harefield rather than to the local hospital, because then she knew the doctors there would know who I was. So the ablation procedure was successful, if not rather traumatic. But then on top of that, I was getting bleeds from varicose veins that I had acquired over a long period of time. The first time that happened, it was a Sunday lunchtime, and I was there serving the dinner, and I sort of felt something wet on the floor, and I looked down and I thought someone spilt red wine all over the floor, but actually it was the blood tipping out of my leg all over the floor. So this became a bit of an inconvenience, if anything, and really was only resolved by stitching where the vein had split. Sometimes they would try to pressure dress it and send me back, and it would just bleed again. So this was a procedure that I got used to, and I knew how to get it resolved, and it was relatively easy. I also then developed quite bad leg ulcers, and then had to go to an ulcer clinic twice a week for about 6 months to get those resolved. And then I also started one day for no apparent reason coughing up blood. I found this actually quite disturbing, and it was quite an unpleasant thing to happen, and I really wasn't quite sure why it was happening. But the team at the Brompton decided that they stopped the warfarin that I was on, but then put me on to sildenafil, and that actually seemed to cure it. So there was some sort of pressure thing going on with blood vessels in my lung. Over this time, I had several admissions to the Brompton for fluid overload and developed quite severe ascites. And eventually, Dr. Alonso said, you know, you should really consider having a heart transplant, and sort of explained that while I might think, well, not my fluid was sort of offloaded, I felt quite well, that now was the time to act and not to leave it until I was so ill that it would be a waste of time considering a transplant. It's quite a tough decision to make, but we were able to discuss it as a family, and this is where I felt that our policy of informing my children about what was going on and what the future held for me paid off, because they were able to contribute to that conversation, and actually we made that decision as a family to actually proceed with the transplant. So I was transferred up north, and this was a big thing for my family to contend with, because my nearest relative was my elder brother, who lived near to Liverpool, and everyone else essentially lived south of Watford. So a massive undertaking for them rather than me, because I was going to sit in the hospital, not come to any danger, be quite safe, and they had to do all the journeys to come and see me. We were lucky enough we were able to rent a flat in Newcastle where my family stayed, and were able to stay when they came to see me. So my transplant journey, I was transferred from the Brompton in 2014 to the Freeman and had a transplant assessment. I can remember Dr. O'Sullivan at the time, after he'd spoken to me for probably about an hour, said to me, the one thing I don't understand about you is you're too happy. You're not sad enough, you're not depressed enough compared to all the other patients we see. And I didn't really understand what he was getting at. I thought, was this a prerequisite for having to have a transplant? You have to be miserable. And it was I put it down to my positive attitude. I didn't want to be miserable. I knew what was going to happen. I understood all the issues, but obviously that was the impression I created to him. But then I went home, and actually only recently I realized that in that period while I was at home, I went with my son to Norwich, where he was at university, dropped some stuff at the house he was going to rent. I went to a football match there to watch Norwich play Watford, the team I followed. And I only remember this a couple of weeks ago when we went to watch the same fixture. And I thought, oh, when was that time we came before? It must have been before the transplant. And when I looked up the actual date, I couldn't believe that I'd done that after having a heart transplant assessment. But then it demonstrates what level of sort of fitness I was actually at the time. But then I came back because, quite rightly, the team at Freeman said, really, your liver is a bit of an issue. And this was news to me. No one had ever mentioned my liver before. But I could understand that, having an anaesthetic is going to damage your liver to a certain point, and the fact that I had all this ascites didn't look good, and therefore I think, well, if that's what they think, that's what I'll go with. And while I was at the Freeman for my liver assessment, the ascites started to leak from my navel, and I sort of ignored it, but when the nurse on the ward saw it, she said, well, we have to do something about that. This could rupture, it's very serious. Okay, so they drained 14 litres of fluid from my abdomen. And I was sort of deflated. And I sat there thinking, well, it's gone. I wonder if it will stay like that. And I went back home from the Freeman, really for my daughter's 18th birthday, which was in September. And I went home thinking, well, if I stick to the fluid restriction and I don't overdo it, I wonder what will happen. And all that happened was the fluid came back, and it came back quicker than I thought. And by this time, I felt a bit rubbish, different to how I felt the last time I was at home. And it really sort of slapped me in the face that I was fighting a losing battle. I could not overcome this with all my powers of positive thinking, that really something had to be done. And that was able to put me in the right frame of mind for enduring waiting in hospital for organs in Newcastle. Of course, there are lots of questions people ask you, lots of questions you ask yourself. And really, some of these I could just sort of run through as to my frame of mind, is that I knew, I've sort of addressed why not wait till you're really ill, because I could understand what Dr. Alonso told me, and now what had happened with my ascites, I knew that now was the time to act. I purposely got into a routine where I actually carried on working a bit in the mornings, writing papers, writing a grant, and then getting into other routines in the afternoon. So I tried to have a day that had some structure to it rather than just lie there and wait for the organs to come. I knew I could wait 3 months. That's what I expected to be 3 months, but 3 months came and went. So I kept trying to keep busy in a way. People always say, well, are you scared? How are you going to cope? What if you die? And I was quite happy that I was doing the right thing. I saw it as an investment of my time to try to improve the quality of my life. And I knew I could die, but I thought, even if I die, it's still the right decision. And I knew that all my family backed me up in that decision. So there was no sort of wailing and gnashing of teeth as to whether I was going to die or not. We just got on with it. While I was there, I met Stephen. And Stephen was waiting for a heart transplant. He was in the room just along the corridor from me. This was after his transplant, when he came back to see me. But Stephen was the first person I ever met who had also had a Fontan operation. And it shocked me. It shocked me because he was half my age. And only then did I understand why Dr. O'Sullivan expected me to be miserable. Because all I could think about was that all the things I'd done since I was his age. I'd got married, I'd had 2 children, I'd worked, I'd traveled the world with my job, talking at conferences like this, going to America, to Japan, Africa, all over the place. I had a house, I had everything I'd ever wanted, and Stephen looked like a scared teenager. And I was so glad, actually, that he got his heart first and made a full recovery and is now doing well. But it was a real wake-up call to me, and all the things I've even heard at this meeting have been, if you like, a bit scary, but I'm glad I still don't have a failing Fontan circulation. But it was a real eye-opener to me. Then on the 25th of April, I had a combined heart and liver transplant. If you want any of the clinical information, you can find it in this paper. But when looking this up, I saw a tweet. I don't do tweeting, but I was impressed by this guy's comment about what an arduous journey for the patient and the team. And on reading the case report, I actually thought at the time that it didn't convey what really happened, what it really felt like. And some of that is summed up in this picture, which I think was slightly attributed to the wrong case earlier, unless he does this after every operation. But I'm reliably informed this is after my extended period on bypass. But it looks like it's a failure, and he's got Asif has his head in his hands. But it's the sheer effort that is conveyed in this operation. I can never quite come to terms That's me in the picture, and it's all my blood on the floor, but so they say. From my point of view, it was an arduous journey. I spent a lot of time in ITU immediately after the operation. So for the best part of May, from the surgery in April. There was an intervening period in ITU between the two pictures here, but I then spent all of September back in ITU with an infection. And really I remember lots of things about these periods, but what I thought was going on, none of it was true. It was all whatever the drugs were doing to me or whatever was happening to me. For example, during the September period, I kept thinking every day I was in a different place, whether it be a hospital, someone's kitchen, someone's bedroom, a shop. But I was always in hospital, but the surroundings were always different. And I could never work out how I went from one place to the other. I was asking people, where am I? And they'd say, oh, you're in the Freeman, you're in the Freeman. I thought, well, it's got branches everywhere, the Freeman. I just couldn't work out what was going on. And I remember when I eventually got well enough to go back to the ward, saying to myself, I cannot tolerate another stay in ITU. I just couldn't face it. And luckily, as you see, within 36 days of that picture being taken, why they took me outside, I really don't know. I was a bit perplexed at the time. Well, A, it was cold. Everyone else had got a coat on. And B, I thought, were they showing me outside for the last time? It gave me some real, that's why I quite like this picture, because it's a contradiction of the whole situation. My cousins had come to see me. They thought what was going on. But anyway, 36 days later, I was enjoying cups of tea in a tea room in Newcastle somewhere with my son in that picture. So once I started to get better, I really did get better. But that period did coincide with being on dialysis. And I did think for a long time that I'd swapped a heart problem for a kidney problem. But fortunately, my kidneys came back. And now I have done probably more physical activity in the last 4 years, but probably the 2 years, than I had done in my previous 50 years. And from really the first time I joined a cardiac rehab group initially at Harefield, and then got referred to one in the gym. The first time I did the warm-up, that was almost enough for me. But if you keep at it and you do it slowly, and you do it with someone who sort of knows what they're doing, slowly but surely I managed to improve my exercise capacity. And now I go to the gym once or twice a week. I play table tennis and I play badminton. And I've gone back to enjoying life, enjoying the things that I always did enjoy and doing some new things, and really just retain my positive outlook on the future, and will continue to make hay while the sun shines. So what have I learned about a Fontan, and what have I learned about congenital heart disease? Take pride in things that you can do, and don't worry about the things you can't do. And in a way, find your niche. I mean, as a child, I liked fishing and model railways, not because I had a heart condition, because that's just what I liked doing. And it suited what I was capable of. But I still played cricket, and I still went and played football with my brothers and mucked about with them. But I found my own way of life. And you have to look after yourself, and you have to have people around you who know how to look after you. And I was doubly fortunate in the woman I chose to marry, or who agreed to marry me, probably. But the point is that we made a good team, and she was invaluable when I needed help. And I was therefore able to access high quality and specialised healthcare. And I think the lessons from Mr. and Mrs. Redpath, who spoke yesterday rather movingly, is that you have to get to the right people at the right time and not sit on something or allow people who don't understand your situation to determine what your outcome should be. And I've always trusted the doctors and trusted what they've told me and questioned it in only so that I can understand it. And I've been lucky to be under the care of some remarkable people. And also you need the support of your family and friends, and you need something that I've had, I think, large doses of, which is good luck. So a lot of people told me that the angels looked after me, but really all the credit goes to the healthcare professionals in the 3 hospitals that have had care for me over the 54 years of my life. Namely that at Harefield Hospital, the Royal Brompton Hospital, and lastly, the Freeman Hospital. And I'm also indebted to my family, my parents, my wife, my son and my daughter, and my siblings for how they've contributed to the success of my healthcare. Thank you for your attention.
Thank you, Adrian. That's a fascinating insight and a wonderful way, I think, to finish the meeting. You're going to send us away with some optimism after a fairly hard day of conference. Is there anything that the audience would like to ask Adrian before I hand over to David, who's just going to conclude the meeting? Adrian, thank you so much.
Thank you.